Take a look at this chart, which is compiled from data from the Bureau of Labor Statistics. It shows how the cost of various items has changed in this century thus far, covering 2000 up to 2025. Overall inflation is 93%, meaning on average, things cost 93% more today than they did 25 years ago. Pretty crazy to say out loud. Average hourly wages have outpaced inflation, increasing by 131%. But take a look at medical care services. It has increased by 147%, outpacing the increase in wages. And the top item on the list by far is hospital services, which has increased by a staggering 281% in the past 25 years. That is triple the inflation rate and over double the increase in wages. You probably already knew that there's something seriously wrong with healthcare in America, but I'm not sure if you quite realized how truly bad it is. So, how did we get here? How did healthcare become so expensive? It's quite a story. You've got good intentions gone awry, protectionist lobbying from certain interested parties, and a seeming unwillingness by anyone to acknowledge incentives, conflicts of interest, and past mistakes. As a quick note, I'll be leaning heavily on the book, The Primal Prescription. The first section of the book is a history of healthcare in America written by economist Robert P. Murphy. Highly recommend checking it out if you're interested in the details. For most of American history, health insurance was non existent. For any given healthcare transaction, there were really only two parties involved, the doctor and the patient. The doctor would provide healthcare services, and the patient would provide payment directly out of his own pocket. I suppose there would be a third party involved if the doctor recommended a certain medication and then the patient had to go to a pharmacy. But generally speaking, if you were sick, you went to the doctor, paid the bill, and went home. Doctors had an incentive to provide quality care at an affordable price, or else doctors wouldn't have a viable business. And patients had an incentive to be conscious of costs, i.e., to be healthy, because they were paying the bill directly. Then things began to change in the 1930s. The Great Depression was in full swing, and people were struggling to afford basic necessities, including healthcare. Simultaneously, there was a shortage of doctors. Changes in medical licensing over the prior decades had made it more difficult for someone to become a doctor, and this development had contributed towards making healthcare unaffordable. Healthcare was so unaffordable that some doctors were being paid not in cash, but in things like eggs or baked goods. In 1932, a group called the Committee on the Costs of Medical Care published a landmark report. This committee, made up of doctors, economists, and social scientists, spent 5 years studying the American healthcare system. Their conclusion was that many Americans weren't getting adequate care because they couldn't afford it. They recommended creating a system where people could pay for healthcare through insurance, taxation, or both. Doctors wanted to move to an insurance model. People would pay a regular premium, and then premiums pooled together could cover patients that got really sick. But doctors also wanted a way to get paid for more than just routine services. So they wanted premiums to cover not only catastrophic events, but also regular office visits and preventative care. As I've discussed in a previous video, insurance is a proven business model that has existed for thousands of years. But when insurance covers more than just catastrophic and unpredictable events, it ceases to be true insurance. Nevertheless, this is what doctors wanted, and they pressed forward. In order to make premiums more affordable to the everyday person, doctors went to the government to make premiums tax exempt. The thinking was that it could be a win win for both doctor and patient. Healthcare covering both catastrophic and routine incidents would be affordable to the everyday American, and doctors could be assured of receiving payment. The government, which had an interest in making healthcare a sort of public good, then insisted on something called community rating. Community rating meant that healthcare plans had to charge the same premium to everyone within a certain geographic region, regardless of gender, age, or medical history. We've already seen one big no no when it comes to health insurance: the commingling of routine incidents with unpredictable catastrophic incidents. Now, another huge no no was introduced: everyone being charged the same price regardless of their actual health risk. While this may sound great on paper, and I'm sure there are people out there who believe healthcare is a human right, charging everyone the same price is nonsensical from a business perspective. So, already, right from the beginning, we have a healthcare system that is fundamentally broken. A monthly premium covers both your routine expenses and your catastrophic expenses, and your premium is the same as your neighbor's premium, regardless of the different health risks each of you have. Nevertheless, the American health insurance industry as we know it today was born, built upon tax exempt premiums and community rating. Now, healthcare in America involved three major parties: doctor, patient, and health insurance company. And there would be one more major change that would further entrench this three party healthcare system. Have you ever wondered why seemingly everyone relies on health insurance from their employer? Well, you have World War II to thank for that. In 1943, the National War Labor Board made a critical ruling. The government had imposed a wage freeze to control inflation during the war, meaning companies weren't allowed to attract workers by offering higher salaries. But the National War Labor Board ruled that this wage freeze did not include fringe benefits like health insurance. This created a massive unintended incentive. Suddenly, health insurance became the primary way for companies to compete for talent in a tight labor market. If you couldn't offer a bigger paycheck, you could offer better health benefits. If an employer offered health insurance to its employees, that expense would be tax deductible for the employer, and the value of the benefit would be tax exempt, i.e., paid for with pre tax dollars, for the employee. But if an employee looked for health insurance outside of his employer, the expense would not be tax deductible for the employee, and he would have to pay for it in post tax dollars. In effect, health insurance through an employer became heavily subsidized. Health insurance out, outside of an employee, health insurance outside of an employer employee context was bound to be more expensive. Try going to healthcare.gov today and see what is the cheapest plan available to you. If you think your paycheck deductions right now are pretty hefty for health insurance, your jaw might hit the floor to see what it would cost if you bought health insurance on your own. In just a short period of time, really under 2 decades, healthcare went from a simplistic two-party model, doctor and patient, to a convoluted four-party model: doctor, patient, health insurance company, and employer. There's much more to the story of healthcare in America, but that's all we'll get into today. There may not be a more hated industry in America right now than healthcare and health insurance. I'm not sure if I know anyone who is happy with their health insurance. The closest I've seen is more of a relief from people. Yeah, what I have is fine, but I guess it could be much worse, kind of thing. Is there any hope that things will get better with healthcare and health insurance in America? I think the system is broken beyond repair. There's too many fundamental flaws, misaligned incentives, conflicts of interest, and a severe lack of genuine self reflection. However, thankfully, we live in a mostly capitalistic society, and thus, when there is a growing problem, there is an incentive for entrepreneurs to provide a solution. I believe one such solution is a company called Crowd Health. Crowd Health is a crowdfunding platform where members pool money together and fund each other's healthcare expenses. As it is legally not considered health insurance, The company avoids onerous regulations that normally make it pretty much impossible for startups to enter this space. Crowd Health offers protection against catastrophe. For a very affordable monthly premium, currently under $200 if you're a single person, you only pay a maximum of $500 for a given health event. If the cost of a given health event exceeds $500, then the portion above $500 will be covered by the crowd. Crowd Health is able to provide such an affordable service for two reasons. One, it doesn't allow high risk customers to enter the pool. You can't join if you're obese or a smoker, and there are restrictions if you join with a pre existing medical condition. And two, it pays healthcare providers in cash, which drives down costs considerably as healthcare providers don't have to waste time and money dealing with health insurance administrators to receive payment for their services. I've been a member of the crowd for years and can't recommend it enough. It's a godsend for people like me who are self employed. And even if you are currently employed, you may find greater value in it than your current health insurance plan. You should check it out. A link is in the description. What do you think? Does this apply to your life? Leave a comment below, and thanks for watching.